possibilities for BIPOC communities. And tonight, we are on our second series and we are covering health and wellness. So let's go ahead and address some housekeeping issues. First off, I hope you all enjoyed those fabulous breakout rooms, the lounges. Every session, we will have these breakout rooms, the lounges, I'm sorry. And we want you to come and just relax and enjoy and learn and network and get some woosah with some of the meditation rooms. And we want to thank all of the presenters that were in the lounges. We appreciate you. Also, you're going to notice that to your right, you're going to have this little bar, and it has your chat, question and answers, polls, and people. If you want to learn who's in the room, you can find out by checking out people. We're going to throw up a couple of polls in a little bit. So we would appreciate it if you would participate in the polls. The polls are important because we're going to let not only you, but our sponsors know what's going on so we can continue doing these programs. And then also, as you have questions, please don't put them in the chat. Put your question in the Q&A. This way, we are alerted and we'll be able to ask your questions to the panelists or to myself. So as you go along, throw any questions in the Q&A. And then chat. The chat is really important because we want you to network with everyone here as well as us. So we want to know who's in the room. I know you've registered, but go ahead and put your company name, put your email address, put your website. Let everybody know who's here. So make sure that you include all your personal information in. And we're going to bring up Risa. You all remember her from the last session. She is our ASL interpreter. And so I apologize for anyone who didn't get the information. Let me go real quickly, not too quickly for Risa, but we're going to start with checking out your people. If you want to know who's in the room, click the people. Yes, you can see my system is going in and out. I don't know what's wrong, but we're going to make it happen. We're going to do what we do. Also, we're going to have polls throughout. Please make sure you participate in the polls. We will also have questions. We want to know what questions you have. So make sure you put them in the Q&A. Don't put them in the chat. Put them in the Q&A. And then also your chat is so we'll know who you are. You can connect with everyone in the room. So put your questions, put your comments, your website. Let us know what's going on. So as I look at the chat, I see Jessica Wade, one of our speakers, is here. Kelly is putting in information. Everyone's putting in information. Put your website in so we can connect with you. Also, right above us, you're going to see a couple of tabs. You're going to see, okay, we're going to make it do what it do. So anyway, donate now. Someone asked last week, what is this donation for? It's so that we can continue to do this work. All of the work that we do is free for the community. We do not charge the community for anything. Whether we are feeding you or housing you or providing these programs or doing workshops and trainings for you, we don't charge the community. So make your donation $5, $20, $100, $500, $5,000, whatever works for your pocket, we would appreciate it. And not only can you make a one-time donation, you can make a monthly donation. You can also check out our website. It says check out PRC, that's our website. Now, what's cool about checking out PRC or making the donation now, if you click those tabs, you're not gonna leave this platform. You'll still be here and you'll see us, and you can continue to have these conversations and engage. Of course, earlier today, you saw the lounges. We want you to continue to come in a little early so you can engage with the lounges. So we have such a dynamic conversation today. I just want to address a couple of things. So first off, today is the end of Women's History Month, and I want to acknowledge every woman. It does not matter what you do, where you come from, your size, your shape, your color, your ethnicity, your gender, you have all done something fabulous, and we appreciate you and the work that you do. Thank you so much. We also want to acknowledge that today is Cesar Chavez Day, and we appreciate and respect the hard work and the effort that he has made changing the world. We also want to address and acknowledge that violence is still real, and we are doing everything that we can to prevent violence. We ask you to also do all you can to prevent violence. And one thing that you could do is just respect the next person. So we're going to go ahead and move on because we have a dynamic program today. We're going to bring up Supervisor Hilda Solis, who is not only a supervisor for the County of Los Angeles, she's also one of our sponsors and one of our partners, and we appreciate and respect her work. So let's bring up the video from Supervisor Hilda Solis welcoming us today. Thank you.
Representing the First District. I'm honored to be here, and I want to thank the Positive Results Center and the Black Women Leaders of Los Angeles for inviting me. I commend both of these critical organizations for creating this series focused on social justice and equity. We can be creative through knowledge, and that is what this series offers, and it comes at a very critical time. Our communities are reeling from the traumatic impacts of COVID-19. People have lost jobs, homes, friends, family members, safety and security. We have also seen how this pandemic highlighted the chasms of need in our community, mostly in communities of color. But we know that these gaps existed before COVID became part of our vernacular. COVID-19 has illuminated illuminated the disparities and the pain. In response to the great need, the county has redefined how it serves its residents. In LA County, we have held over 70 food distribution events, totaling almost 4,000 tons of food, which is the equivalent of 6.4 million meals provided to over 120,000 households. In my district alone, I hosted over 30 food distribution events, providing for almost 60,000 households to help combat food insecurities that have always existed but have been more exacerbated under COVID-19. I see the devastation as cars line up to get boxes of food, diapers, and baby formula. And I have launched a $30 million community health workers program, ensuring residents have the information they need on how to keep healthy in their language. We've also addressed the digital divide, dedicating almost $13 million to get devices and internet into the hands of our students. And I'm also addressing housing insecurity for those who are chronically experiencing homelessness and are justice impacted, in line with the commitment of Care First and Jail Last. Their specific needs have only been magnified, and that's why I directed the county to work at this speed on this crisis, which requires us transforming a county-owned properties in Chinatown to become 232 interim housing beds in record time. And I'm also leading the effort to close Men's Central Jail, as we have long recognized that people do not get well inside a jail. Los Angeles County is committed to investing resources so that our residents receive the care that they deserve. That means housing, medical and mental health care, food, education, and of course, jobs. It means meeting them where they are. Let me be clear, we have to get at the root of these problems, which is structural racism that has existed for many, many decades. Series like this, where the community comes together to strategize and mobilize, are key to doing that. Without the support of dedicated and persistent advocates like yourself, we would not have gotten to this point. But I recognize that we still have a long way to go. It takes all of us pushing forward in a way that is not just equal, but equitable. Not just for some, but for all. Thank you, and I hope that you walk away from these series empowered to continue striving toward justice for all.
Thank you, Supervisor Hilda Solis. We appreciate your support. Next, I have a special treat for you. We love art. We think it is important and critical to our life. And so we have a young lady. All the rest of our attendees, or excuse me, our speakers will be introducing themselves and telling you about themselves. But this young lady, I'm going to read her bio. Tandra Mosley is the CEO, founder of TEARS, that is Traumatic Experience and Restoration Strategy coach. She is an international best-selling author, mentor, poet, spoken word artist, choreographer, and interpretive dancer, performing and speaking for over 20 years throughout the United States. She is also a certified human behavioral science consultant, a certified sexual assault and rape advocate, a certified suicide and crisis educator, and she's on the board of the St. Clair County Youth Board Coalition. And she's going to be bringing up a dynamic piece. So let's bring up Tandra.
This is a wellness check. I'm checking in on my thoughts and emotions, checking in to make sure that I'm on point and accurate, but not hurtful with the words I say. I'm checking in to verify that whatever pain that happened on yesterday does not spill over onto my today, unless I'm bringing bliss. Because I'm not responsible for how others treat me. I'm responsible for how I treat others, and I must always remember this. I'm allowed to feel all that is truth, but I'm not allowed to feed you my anger, my fear, my disappointment, my grudges. It's not okay to spew poison onto you. This is a wellness check. I'm checking in with my thoughts that direct my actions to make sure that before I step out to face the world, that I've taken out time to check in on you, girl. This is a wellness check. To see, have I consulted with the Father to see what is his agenda for me today? Checking in to see whether or not my energy is at a level that I can execute whatever it is that he say. I'm checking in to see if there are things on my list that I left incomplete on the day before, and making sure that I apply the right medication and meditation to whatever it is that is sore. Because I'm not responsible for how others treat me. I must be a good steward of the currency of my energy. Remembering that I am to a plant and must speak life to me. And be mindful of my actions and my words because they are all seeds. Conscious of the proper intake of food, light, movement, and sound that my body needs to move about. Is it all within my reach? What is the cost of the energy that I have to give out? This is a wellness check to make sure that I do right by me and do right by you. Today, I must be found doing what God has purposed me to do. I walk in confidence knowing that God has graced me sufficiently. Or I sit patiently in silence as he clothed and equipped me fully and confidently. I am ready to now move about with my mission, with a sword of forgiveness and my words for peace. Now I am ready. Now I am ready. Thank you.
Tandra, that was fabulous. Thank you so much for gracing us. It was beautiful. So next, we're going to just go ahead and jump right into this conversation. First, I want to share with you all. Some people are asking, so what is this series about? Advancing social justice is so important because we know that people are not being treated equally or fairly. And so we want to look at it from every standpoint, including today is on health and wellness. We need you to put your comments in the chat section. What are your concerns? What would you like us to talk about? What issues are you really concerned about so that we can bring them forth? Because this is no longer a 6-part series. It is going to be a year-long series. If you are a BIPOC, Black, Indigenous, people of color person, and you're interested in participating, please put your information here and say that you're interested so that we can reach out to you. And make sure that you give us your comments and your feedback. We appreciate it. Okay, so let's just go ahead and move on and bring up this fabulous group. We first want to bring up, oh, you know what? I need to get my phone because I want to really make sure that we have everyone in the room that is supposed to be here. I'm going to start with Daniel J. He is with APLA Health. Come on up, Daniel. Great. Next, we're going to be bringing up Ina Valadares. She is the Director of Programs from the California Latinas for Reproductive Justice. Awesome. And next, we have Chidi Njoku, and he is the Director for Behavioral Health Department at Kaiser South Bay Medical Center. And I'm sorry, I forgot to tell you all that Daniel is the Prevention Training Specialist at APLA. So this is a great panel. I want to thank you all for being here today. We're going to have a great conversation. And let's go ahead and start with Ina. Ina, I have a couple of questions for you. So I'd like to find out, how has COVID-19 impacted the health equity gap for Latinx, Latina community, and what opportunities does telehealth present in addressing the health equity gap? Can you hear me?
Yes. Hello.
Okay,
can you
great.
hear me? I just want to make sure. Yes.
Yes.
Okay. Hello, everyone. Good afternoon. Thank you, Candy.
Oh, you know what? I'm sorry. Tell people who you are. Tell them a little bit about yourself. Just about that much.
Okay, sounds good. So good afternoon, everyone. Thank you, Candy, for that introduction. My name is Ena Suset Valladares, and as mentioned, I am the Director of Programs at California Latinas for Reproductive Justice. Just a quick little thing about CLRJ, that's the acronym for my org for short. We are a statewide organization here in California. We are based in LA, but we do statewide work. And the different strategies that we use to advance our work include policy advocacy, community engagement, community-informed research, and cultural shift. So definitely wanting to change the conversation, the dominant narrative on a lot of these different issues. And so with that, when we do this work all under the wonderful framework of reproductive justice. And basically, in a nutshell, we believe that, a lot of the issues that our communities face are not, they're not single issues, and we can't separate the whole person. We have to look at, everything that's going on in the person, with the person, in their communities, opportunities they have, the systemic barriers that exist in order for, everyone to be able to make the best decisions for themselves and their families. So that is kind of like, just to give a kind of an overview of how, we do our work at CLRJ. And now, Candy, to address the questions that you posed for me. So, as what has been mentioned already, COVID has definitely impacted tremendously many of our communities, including the Latina, Latino, Latinx communities. And I think a lot about how disproportionately we were impacted, not just in the cases that we saw in our communities, the hospitalizations, and the death rates. But COVID just exacerbated what we already knew existed, a lot of these health inequities to begin with. And this is why we were seeing the numbers that we saw and that we continue to see. for particular communities. These racial and ethnic wealth and earning gaps existed pre-pandemic, right? And the fact that a lot of our community members are disproportionately concentrated in jobs or sectors that were the hardest hit. That's why we see these massive effects, right? And then in terms of access, we also saw that due to a number of reasons, there were barriers in order for folks to access the care that they needed. Whether we're talking about insurance access, and we already knew that pre-pandemic, there have been issues. A lot of our community members often face a lack of access to healthcare, whether it's because of lack of insurance or ability to pay. And if our undocumented family members face an even bigger challenge, right? Because they don't even have many options outside of community clinical settings, for example. And then the other thing that exacerbated these issues is oftentimes, job loss was a huge issue for a lot of our community members. And oftentimes health insurance is tied to jobs, right? And so that also further impacted, people's health insurance access. And so in looking at this, and in looking at these lens, we also see that there were other opportunities. And I know, Candy, you mentioned telehealth. And while, telehealth has existed for a really long time, it has been used in different healthcare settings. And I think COVID just really accelerated its use because of, its ability to deliver services, online, virtually, right, without the need to come in person. And while, telehealth, yes, offers, I think, great opportunities, especially around increase of access for communities that may have been facing certain barriers, whether we're talking about regional barriers like rural communities or transportation issues, getting to the care that they need, or even just being more flexible in appointment times and being able to seek specialized care. My organization, along with other partners, are a little worried that telehealth can also be a form of exacerbating some of the inequities that already exist, or even create new barriers. So what do I mean by that? And I'll just go through these really quickly. I think about issues such as not substituting in-person care for folks who really want to be seen in person, right? And not substituting those types of appointments with just virtual appointments just because they are available. I also think about addressing the privacy and confidentiality of these services. We can't assume that everyone who's at home is in a safe space. And I think a lot about young people in particular, safe and private space. So I think a lot about young people. And I think a lot about folks who are in intimate partner violence situations or domestic violence situations where that might not be a virtual appointment be a good option for them to receive the services that they need. I also think about the real mistrust in a lot of our communities of providers, of the medicalized system. And what does that mean to invite a provider into your space where they can see your home? And we know like the disproportionate perceptions of parenting of certain communities, and whether because you live in a low income household or because you are of a certain race or ethnicity, right? And so what does that mean really to invite a provider into your home and in such an intimate way? And then I would be so remiss to talk about the digital divide, or the digital redlining as it's also known. So we can't assume that every household has access to a speedy internet or Wi-Fi or data plans, or even smartphones or computers, right? There is a real gap in that type of access. And in addition to that, we also can assume the digital literacy of the community members that are accessing this type of care, and whether that has to do with, navigating the internet, but also a lot of the internet is in English. So, and many of our communities, that may not be the language that they're most comfortable reading. There's also this concern about our community members with disabilities, for example, and how, whether, visually impaired or other types of disabilities that may cause, right, barriers in order to be able to seek the care that they need. And then lastly, to wrap up this question, so sorry, yes.
Okay, go ahead and wrap that up. Go ahead and
wrap
I'm
that sorry. And I'm sorry, the last point I just wanted to make was the actual infrastructure of the clinics, right, or of the provider settings. So we can't assume that necessarily the clinics have the infrastructure to be able to do that, right? And so ensuring that, whether it's reimbursements, whether it's the actual infrastructure of the facility, that's also in place, so that people who go to these clinics already are able to access that care virtually if they want. So that was my last point, Candy. Sorry about that.
Thank you. Oh, no worries. Thank you so much. That's a lot, and all of that is real, and that addresses a lot of the in several communities. So I'm sorry, everyone, I apologize in advance for my system. And so I actually want to move on to Chitty. Chitty, let's talk about this, because you're doing a lot of the work. You, Kaiser, mental health providers. And so I know you probably want to address some of what Ina said. And I want you to talk a little bit about the psychiatric services that your organization has placed to support our community as we make our way through this pandemic. So go ahead and do that, please.
Yes, appreciate the time, Candy. Thanks for the invite, and hello, everyone. Kaiser's been really active over the course of this last year in, just really focusing on trying to maintain care in a really consistent way to folks. As we all know, this last year has presented more than its fair share of challenges, and there were people that were experiencing significant mental health needs prior to the pandemic, and then the pandemic kicks in and it's simply exacerbated that need. But we also had to maintain, pay attention to the social constraints as far as social distancing, so on and so forth. And so we had a very significant shift from face-to-face services to virtual services, and that shift to virtual services has been really impressive, I would say, in terms of folks having to get over their angst about the quality of virtual services versus face-to-face, and just embracing the resources that we had accessible to us. And so what we saw was the services. We saw individual therapy transitioning to a virtual platform. We saw family therapy, couples therapy transitioning to a virtual level. Now, what I'll admit is that there are diminishing returns on virtual visits, especially when we're talking about our children and our adolescents. Adolescents we saw a little more success in that venue, but with children especially, when we're talking about a child dealing with ADHD having to sit in front of a screen for an hour to talk to their therapist, it was a challenge. And so we saw that portion of our patient population have some challenges as far as the positive effects of those services, but we continued on with that. We've also seen a significant increase in intensive outpatient services, where we in essence were providing care to our most impaired members, anywhere from a 3 to 6 hour portion of their day, just really trying to wrap our arms around them and address those special needs that were coming up as this pandemic wore on. We also saw more than a fair share of, and I think it's important to acknowledge the fact that we celebrate our essential workers and the courage that has been demonstrated in showing up to work each day and continuing with those services on a regular basis. But that also came with its fair share of emotional challenges as they were putting themselves at risk, as well as their families, because they're coming to work and doing their thing every day so that they could pay their bills and what have you. But then they had to worry about whether or not they were taking COVID back home. And so our work stress program, which we have been offering, had to transition to a virtual level, and we saw that program boom in a huge way. And so, but we continue on with those services as well as really focusing on the emotional trauma that people have been experiencing over the course of this year. We know it's well documented the social strife that was going on as it relates to the murder of George Floyd and the ripple effect that created. And so there were huge demands for trauma work just in adjusting to everything that was going on. And so that was another area where we had to really bolster our services. And I was really proud of the team as they've leaned in and extended themselves in great ways to be able to meet the needs of the members and those in the community. So it's been really great to see how this work has worn on. It's been really great to see how people have been looking at themselves and seeking to look more deeply and examine ways to better cope with life. And I've also been really proud of the clinicians, both the therapists as well as psychiatrists, as they have also had to overcome their own anxieties about this pandemic and continue to show up each day for their members.
Right, that's so true. Thank you so much. And did you share a little bit about who you are?
Thanks for the reminder. So yes, I'm Chidi Njoku. I'm a director for behavioral health at the South Bay Medical Center for Kaiser Permanente. I've been working in the field for a little over 20 years now. And I've worked with everything from homeless families in Skid Row to foster kids, group homes, school-based work, victims of violent crime, addiction. I've done some worked for about 3-4 years in the HIV clinic. And now, the last several years I've been working as an administrator for Kaiser, but, on the side, running a small private practice just to maintain my clinical skills. So it's, it's been a nice journey.
Awesome. Well, thank you so much. And you brought up our next conversation with Daniel. So welcome. First off, before I forget, love for you to share a little bit about who you are and what you do. And then I want you to talk about why is HIV so prevalent in Black and Brown communities, especially on its impact on girls and women.
Absolutely. First and foremost, thank you so much for having me. I love Miss Candy Lewis, and of course, I love PRC, so it's always wonderful to do community with them. My name is Daniel J. I'm a prevention training specialist with APLA Health. We have several different clinics throughout Los Angeles County, all the way going to Long Beach, over in our Mid-City area, as well as our Baldwin Hills area. I specifically work with an initiative that we started about a year ago, last July. It's called Swab and Chill, which is our at-home HIV testing initiative. As most people who work in public health know, when the pandemic hit, testing literally shut down. All HIV testing, STI testing shut down. Facilities who did keep it going were so overbooked that a lot of people within the community could not get an appointment to get tested. And so we came up with the idea to create an initiative where people can go through a less than 10-minute assessment with me over the phone. We put a kit together that includes not only a easy 20-minute HIV test, but also a safer sex kit. We have PPE things in there, such as a mask, hand sanitizer, things like that. And people can take the test at home, and we walk them through the process. It's an easy swab test. It's a swab of the upper gums, the bottom gums. They stick it in a solution, go watch a sitcom. 20 minutes later, they have their results. And of course, if we have a client that does test positive, then again, we are walking them through the process to set up their first appointment and linking them into care. The prevalence with HIV as it pertains to the Black and brown community, specifically to young women and girls. Overall in the community, when we look at statistics, HIV is hitting very hard for young men of color who have sex with other men between the ages of 18 and 24. That number has always and continues to dominate a lot of the statistics in our communities, and that's across the board. As it pertains to women and young girls, unfortunately, yes, Black women are one of the highest statistics that we see of new HIV cases. However, when they are compared to some of the other statistics, it's not a very high number. And I say that not to disregard women or not to erase the conversation about HIV in women. I say that to say that there's not a lot of data. That means that there's not a lot of information where women have, specifically Black and brown women, to know how to have the conversation surrounding HIV. They don't know how to ask their partners, are you sleeping with other people? Are you using protection? What type of sex are you having? And a lot of that is more so less a clinical conversation than it is a cultural conversation. In Black and brown communities, we're not taught to have comfortable conversations around sex. I know me growing up, it was like, don't do it until you get married. If you do it, you're gonna get pregnant, you're gonna have a baby. And so there's a lot about women that is so secretive in their cultural and upbringing, in their anatomical upbringing, where women are unfortunately just taught, figure it out as you go, but you can't have the conversation. So how do I figure it out? I can't ask the questions, and so part of the work that we do with Swab and Chill, not only to get people tested and to know their status, but we also try to rid the stigma of having a sexual conversation and really talking about sexual health from a different perspective, really talking about sexual health from a perspective of empowerment and encouragement, and really helping people to take agency in what they like to do in the bedroom, what they decide to do in the bedroom. Because I'm not here to yuck anybody's yum. I'm just here to make sure that you do it safely and that you're making an informed decision.
Yes. Thank you so much. That is so true. My mom, who's watching, I can only remember her saying, I know you're not doing that, right? And when my kids were growing up, I was trying to talk to them. Now, my oldest daughter, she wanted to know everything about sex. And my youngest daughter would be like, oh, Mom, oh, don't say anything. So, but it is important that we have these conversations because first off, let's just be real. We are sexual beings. People
Absolutely.
are sexual beings. And at one point or another, almost everyone will have sex. And so it is so important that we inform our kids, we educate our kids, because as a friend of mine, Terry, always says, if you don't talk to your kids, somebody in the streets will. And the things that people tell kids, it's just ridiculous. So let's just be forthright and honest and talk to our kids. And it's really easy as they're young. If they ask you a question, just answer that one question. And then let them know that if they have any other questions, that you are there for them, and answer it honestly. Don't give them any bull crap. Don't tell them about the birds and the bees, because the birds and bees ain't got nothing to do with it.
And to be honest, Candy, one of the things I let, especially my parents, know is that kids are ready to have the conversation when they ask the question. And if you don't know, it's not your job as a parent to know. You don't have to know everything. Sometimes saying, I don't know, let's find out together is such a bonding experience for parents and their children to really go on that journey of education and discovery. And if we look at the science of things, when we look at cisgender men, we reach our sexual peak right around 30, 35.
Hold on.
Women don't.
Hold on. I need you to tell people what cis means, because people don't know. So
we've all been introduced to the community. Well, not introduced, but we really understand what transgender means. It has really been getting a lot of visibility, as it should. Cisgender basically means that the sex that you were assigned at birth is the sex that you currently identify as. I was assigned male at birth. I identify as a male in my life today. So I would be considered a cisgender man.
Thank you.
So that's that conversation. And like I said, cisgender men, often we peak out sexually around 30, 35. women don't even reach their peak or start to getting to their peak until after 45. So you
Right.
have men who have all this sex in the beginning and then they wear out. And then you have women who are trying to figure it out in the beginning and they get into their mid 40s and it's like, I want to try all these sexual things, but culture and community has shaped them into feeling like they can't. And so those conversations are conversations that definitely need to change. And that is part of the work that I do with Swab and Chill, as well as with APLA as a prevention training specialist.
Thank you. And I want to say that's part of the work that we all do. That's part of why we're here today, because I know that's what Ina does. I know, Chitty, you talk about it. There are people all at Kaiser, as well as Positive Results Center, and all of our speakers that are coming up. So let's roll on over to Ina, and let's talk about how has the pandemic impacted access to reproductive health? And then if you want to add anything about HIV, that would be great. And let me just also say that we have about maybe another 10, 15 minutes in this conversation. So if anyone is interested in asking a question, remember to put it in the Q&A. Okay. Ina?
You'll hear me, correct? Oh, got
Yes.
it. Okay. So thank you. I think Daniel really covered one of the major issues of how the pandemic impacted reproductive care is that it shut down a lot of the testing, but then also just general appointments, right? Because a lot of the appointments that were available were really being prioritized for COVID. And so, it was really difficult to get well women or just general preventative exams, for example, STI testing, as mentioned. Abortion care was also impacted, because of certain rules where this idea that, abortion can only be, or this misperception that abortion is only available in person, but actually we know that there is medication abortion. And this is a medicine that you can easily pick up and take home with you when you can have an abortion at home, for example. And so so what I'm trying to say with this is a lot of folks also don't understand like what is available to them, right? And so it's this issue of not having all of the information and then also having real barriers in terms of like being able to access appointments for the care that they need. And the other thing I want to lift up, though, is that, yes, COVID definitely exacerbated a lot of these issues. But prior to COVID, right, we still saw a lot of barriers to care. And we did see a lot of like adverse health outcomes because of those barriers to care. And so I think I want to give time for the rest of my fellow panelists to weigh in on this, but I just want to leave the point of like, I think there was a lot of great strides that we made. I think Chidi also pointed to some of the great strides that a lot of like providers tried to do to meet this moment of being in a pandemic and having to think about creative ways in order to expand access in other ways. And so I think what we're tasked to do is to take the good, right, that we were able to see in how to provide better services, expand those services, but then also again address, right, what in that expansion and in that move to this technology, to the different technologies, how we can prevent, right, further exacerbating these barriers. And I think at the core of everything, we really have to center equity, right, and really meet people as to what it is that they need in order to get the care that they need, and when they want to get that care, and how they want to get that care, right? And there's a lot that goes into it, but I think that's how we're going to be able to move forward in order to keep addressing these incredible adverse health outcomes and economic fallout, really, that has, that a lot of folks are experiencing because of COVID.
Thank you, Ina. And so, Chidi, let's go back to you. I want to find out, as your organization has been treating the community members, what are some of the trends that you're noticing in the clinic, and especially around women, kids, depression?
Yeah, it's thanks for the question, Candy. I think amongst women slash families, children, parents, children, which when we on the parent side, a lot of times we see more significant trends amongst the mothers than the fathers. But what we're seeing over the course of the last
He'll be back.
Okay, sorry about that. Um, so what we've seen is a huge jump in the just the overall decline of mental health and well-being in our family units. So, like for example, we saw over the course of last year, leading up until around October when it kind of plateaued, we saw about a 24% increase in the number of children ages 5 to 11 that were having to go to the emergency department for mental health related issues. Amongst the 12 to 17 range, we saw an increase of about 31% of children that are ending up in the emergency room for mental health related issues. And so, as being a parent myself, by the grace of God, I never I never experienced a situation where my kids were so debilitated that they needed to go to the emergency room for something related to their mental health. But my heart breaks for the parents involved in situations like that, and just the amount of despair and and heartache that goes into seeing your kids break down to that level. We've seen significant increases in depression. Approximate, that number when we look at, we especially looked at, parents that were homeschooling. We saw, on average, parents coming through the clinic about around 20% increase in, depression, anxiety, stress level is through the roof. We've had lots of conversations around just the stressors associated with homeschooling and how difficult that's been, trying to juggle the responsibilities of the day-to-day coupled with trying to make sure that your kids are getting taken care of. And you also think about, just on a really practical level, a lot of the folks that we work with don't, they're not coming from well-to-do backgrounds, so it's not like they're living in homes where there's all this space where they can get separation between them and the kids. It's two or three rooms sometimes that they have to go to, and so there's not really a place to escape to. And so for the kids as well as the parents, the impact of this time has just been tremendous. And so again, it just further heightens the need for ongoing mental health care, and the need for it to be presented in a way that makes it accessible, like Anna's talking about, and effective. So again, for all the providers that I interact with and know of, I know that folks are working really hard to try to make that happen. But it can definitely have its challenges.
Wow. And so one of your partners, one of our partners, Janae Oliver, just sent a comment. There was an article in the Los Angeles Times about how many college students are being forced back into the closet. They had went to college and they came out, and now that they're back home, they're forced back into the college, or excuse me, in the closet, and that has impacted their mental health as well. So just like you two, because we're coming down to, time just flies by too quickly in this space. So Chitty, I want you to just, if you could very briefly talk about what significant barriers to getting people mental health that they need, and any solutions that you might see. And if anyone wants to add in the mental health, go right at it.
Okay. So real quick, I'll just say, so a number of things come up over the course of this last year. First of all, I think it was Anna that was talking about how people have been losing their jobs. We see insurance go out the window, and so lack of insurance automatically right off the bat jumps to the top of the list. We also combat the issue of stigma around mental illness, which is, has been talked about, for years. And the fact that, this is something that we need to address more effectively. And there's lots of campaigns and lots of efforts have been done to diminish that reality. But, the fact still remains that it's still an issue for us. We've also got the issue of culturally competent care. Because, it's one thing if I finally work up the gumption to walk through the door to ask for help, but if I'm sitting in front of somebody that doesn't get me, I'm gonna walk right back out that door.
Yeah.
So that's a huge piece as well. And and then we've got distrust in the healthcare system, which is another issue. And so all of these things factor in, in terms of barriers to resources. Now, some of the things that we can do to try to combat this, I think the reality is, and it just kind of goes back to the old adage that it takes a village. The reality is that stigma, yes, the campaigns mean something, but the other piece that has a really profound impact is those one-to-one, those one another relationships, our interpersonal relationships.
Yeah.
I'm going to take feedback a lot better from somebody that I know and trust than a random stranger on TV or what have you. Sometimes the TV commercials and what have you, they're great and they can help if they catch me in the right moment. But if my best friend comes to me and is like, hey, Chidi, you're a little off. You've been off for a little bit. This is what I'm seeing. I noticed you here. I know, maybe we should have a conversation, or maybe you should talk to somebody. I'm going to be more likely to take that from somebody that I care about, or that I know cares about me and has my best interest in mind, than a random stranger. And so, I think us all being, willing to acknowledge the fact that, it's our shared responsibility to, when we see somebody that's struggling, to wrap our arm around them and, say, hey, come on, let's go over here. Let's see what we can do to try to help get you out of this rut you're in. I think that goes a long way, as well as, within the structures that we work in, like, for example, in my department, over in Kaiser, we're taking it very seriously, the need to make sure that our clinicians are culturally competent, that they're paying attention to their own biases, being willing to look internally first, but then being courageous enough to step into those conversations with the members that they're sitting with, and acknowledge the challenges that, or the divide there, and seeing how they can bridge the gap to meet on common ground.
Thank you so much. I know I appreciate all the work that Kaiser does in the community, as well as the work, that you and the California Latinas for Reproductive Justice does. But I would be remiss if I did not bring Daniel in. And Daniel, we're wrapping up this conversation. I'd like you to really talk about, very briefly, because we're already over our time, what is the biggest misconception about HIV PrEP, and the most challenging part about working in the HIV prevention field?
I think the biggest misconception about HIV is that most people are misinformed and they're still carrying around the information that we had back in the 80s and late 70s, which is that as soon as you get HIV, you're going to get AIDS and die. That is just not the truth. Medicine has progressed so far. Science and research has progressed so far. There are hundreds of thousands of people living with HIV, living healthy lives, thriving in what they do. And, HIV doesn't have a look. Maybe in 1980, 1979, 1985, it did, but it doesn't have a look anymore. So I think that's the biggest misconception as it pertains to HIV, that you can still live. It is not the end of anything. As it pertains to PrEP and PEP, which are two services that help to prevent getting HIV for those who are HIV negative, I think the biggest misconception there is that it's just for gay men. Women can use PrEP. It has been shown in research to help women, just as it is been shown to help men in preventing HIV. It's a one pill that you take once a day, and it is 99.999% effective in preventing HIV. And of course, PEP is for those who feel like they have come in contact with the virus. If they've been exposed to HIV, they, within a 72-hour period, can get on PEP. And it's a process that you take for about 28 days. And again, very effective in helping you prevent that. I think the most challenging part about working in HIV prevention is getting people to understand that we are in a new age of medicine and care. And also getting the community, specifically Black and Brown communities, to understand that this is not, and I'm sorry if I offend anybody watching, this is not a white disease. This is not a white thing. There are people of color who work in this field and are very passionate about the communities that we belong to. And so part of my personal challenge is getting providers to understand that there is a cultural competence that they need to have, and that it is going to be a challenge for us to gain the trust of communities that have been lied to for so long and that have been used in, you know, X amount of studies with no real reward in doing so, you know. So that has been the challenge, but I love the work that I do. I always remember that people are people. They are not a quota for me to meet. And as long as I keep that in my heart and in the forefront of my work, then every client that I ever meet will be treated as the human being that they are.
So thank you so much. And I'm sorry, I don't have enough time for everyone to give a last statement, but I really want to appreciate each one of you for not only being here today, but for the work that you do, for the way you serve the community, the way you treat and respect people. We're about to bring up our next panelists, our next group of panelists. So Daniel, Ina, and Chitty, thank you so much. And while we are bringing them out, I see there is a question, and I think that question will be very well answered in the second panel. So we will go ahead and hold that. And I want to say thank you all again. While we are transitioning out, I want to acknowledge both Susan and Risa. And I see all the comments in the comment section in the chat. What an outstanding job you are both doing. So Susan and Risa, we appreciate you. So I really want to acknowledge that first off, I apologize for all of the issues that we've had. It looks like most of them have been worked out. And so I hope you all are enjoying this conversation. We ask you to continue to put your questions in the chat section. We ask you to continue to engage and share if you have not shared who. Without further ado, I want to go ahead and let you know that we have a survey. So have you experienced any or all of this during COVID-19? And if you have, go ahead and answer it. We've got depression, suicidal tendencies. Oh, I can't see access to doctors, one or more of those. So go ahead and answer that while we bring up our next panelist. I'm excited to bring up. Okay, so I'm excited to bring up a friend of mine. I met her through her father, who was assisting me when I became the executive director of Positive Results. And Miss Jessica Wade, just come on up, Miss Jessica Wade with Mighty Little Giants. And we're going to have them do a brief introduction in a moment. I'm going to also bring up Dr. James Kyle with LA Care Health Plan. And my friend and my sister girl, she is one of the original Black women leaders of Los Angeles, Miss Jeanette Robinson Flint. And what I'm super excited about is that it was a year ago tomorrow that we had our first meeting, the Black women leaders of Los Angeles. So Jeanette, come on up.
I think I'm here.
Yes, now you are here. Awesome. So everyone, first off, I just want to say, looks like we might go over a little bit. I apologize. I hope you all can stay because this panel is fabulous. Our first one was as well. So go ahead, Jessica, do a quick, brief introduction of yourself.
Thank you so much, Miss Candy. First of all, thank you for creating this space for us to have these amazing conversations. So my name is Jessica Wade. I'm the founder of Mighty Little Giants, which is a nonprofit organization that supports families who have babies in the NICU. In addition to that, I am a certified doula and a lactation education specialist. And so I'm just here to share my voice and give my input. And that's a little bit about me. Thank you.
Awesome, awesome. And then we're going to go next to Jan. We call her Jan, but y'all can call her Jeanette Robinson Flint. She gonna tell you who she really wants you to call her. I know she gonna tell you to send her a check. And by that, I meant to say donate now so we can continue to do these works. We appreciate your support, and all donations will go to this work, as well as supporting our sister and brother partner agencies. So Jan, why don't you tell us a little bit about yourself?
Okay, then. My name is Jeanette Robinson Flint, and that's my legal name, my government name. But actually, you don't have to send me a check today. How about that? You can send one to Positive Results, or you can send one to Black Women for Wellness if you are being generous. How about that? Most people call me Jan. If you call my house and you ask for Jeanette Robinson Flint, I'm going to think you are a bill collector, because yes, they call my house. What can I say? I am one of the founders. There were 6 women who founded Black Women for Wellness. We are a community-based, grassroots, women-driven advocacy and health education in California. Our office is in Leimert Park, which is where I'm at now. So I know all about internet and technology glitches, because we're in that neighborhood where it happens on a regular basis. Our work started being sister friends for expectant women. The 6 of us who started Black Women for Wellness had 23 pregnant women we were mentoring. And that's when we realized maybe we need to start an organization. More importantly, we said we needed some help, and that's how it started. So now I'll just leave it there.
Thank you so much, Jan. And Dr. Kyle, I am so honored to have you here. Dr. Kyle is with LA Care, and we're super excited because LA Care is also one of our partners, as well as our sponsor, as well as we've been collaborating with LA Care in the different community centers for about 8 years now. That includes Linwood, East LA, and Inglewood. So Dr. Kyle, go ahead and introduce yourself.
Well, hi, I'm James Kyle, and hello, Jessica. I just saw you not too long ago. I'm born and raised in Los Angeles, California. I'm an ordained minister as well as a physician, and I'm working at LA Care as Director of Quality, Diversity, Equity, and Inclusion, and having a great time, and looking forward to the conversation this evening.
Great. So I want to formulate this conversation around equity, but also women, Black and brown women in particular, and our health. And so, Jessica, I know I've asked you to share a little bit about your truth. And since we have a little less time than expected, I would like you, if possible, to give maybe the 3-minute version. Okay.
Okay, thank you so much, Miss Candy. So a little bit about me. I'll share a little bit about my story, which is actually the foundation of what my organization is built up on, was built off on. So with me, my journey started with my first pregnancy. Me and my husband first found out we were pregnant. At our first doctor's appointment, the doctor told us that we were pregnant with empty sacs. There was no heartbeat for the baby, so we need to do an emergency D&C. We did not receive the compassion we needed in that moment. So on our hearts, we didn't agree with what the doctor was saying. And thank God that we didn't, because we scheduled the surgery 2 weeks out. And when we went in for the procedure, they found 2 heartbeats. And so in that moment, I just put myself in a young Black girl's, like, what if I was 17, took the bus here, young Black girl, thinking that the doctor knows everything and not trusting my own body. So in that moment, I knew this was going to be a journey. Fast forward to from 6 weeks to 21 weeks pregnant, I went to the urgent care 7 times because I knew something was physically wrong with my body. I just knew that there was a problem. I kept going to urgent care, like, no, you guys check me. Something is going on. They're like, no, you're fine. Put your feet up. Turns out I wasn't okay. We had a twin pregnancy. We miscarried one of the babies, which caused me to be on complete hospital bed rest at 21 weeks. Within our hospital bed rest time, I was on hospital bed rest for 58 days, and our son was born at 27 weeks and 6 days, and he was in the NICU for 143 days, and now he is 7 years old. And so that is a little bit about my story. The reason why I wanted to start Mighty Little Giants is because I wanted to stand and bridge in the gap and advocate for those mothers who were just like me and be everything that I needed in those moments when I was being overlooked, when my pain wasn't being taken seriously, when I was going through postpartum depression and covering it with a smile. And so because of that, now I do that with Mighty Little Giants. We support mothers and birthing people through their postpartum journey, and we also stand in the gap and bridge the gap for those families who whose moms are on hospital bed rest. So I think that was my 3 minutes, Miss Candy.
Girl, yes, you put it in there. And I'm so honored that I've known you through all of this and I've witnessed all that you went through. And you are such a phenomenally strong woman. And I want to say that and put it in context, because they always say that Black women are strong. And then that is part of what leads people to not pay attention to our pain. So I want to say that you were strong in heart, strong in spirit, to just go through all of this. And you went through that really fast. And some people may not really be up with numbers. They think about pregnancy in terms of months. Oh, she's pregnant for 9 months. So you said that at 21 weeks, you lost your baby and you were hospitalized, for 58 days, and then your baby was in the hospital for 158. So talk to us in terms of months.
Okay, so, oh goodness, so my water broke, I would say, so 21 weeks, what is that, like 4.5, 5 months? Marlon was born at 6 months, where, my water broke at 21 weeks. A full pregnancy is 40 weeks, right, for full term. And so water broke at 21 weeks. I delivered Marlon at 6 months, so 3 months early.
And you were on bed rest for 2 months?
Yes, for 2 months. I couldn't even get up to take a shower. Talk about a test through your marriage and everything. I mean, Miss Candy, my goodness, and I didn't mention it, but me and my husband, we went through a lot. And while I was on bed rest, we lost house, cars, jobs, everything. And so the amount of stress I was on just to try to keep my son alive, in addition to the stress that was happening outside of the hospital, I didn't have anyone. I mean, there were my nurses, some of them were amazing, some of them were just doing their job, and some of them weren't, to the point where when I actually went into labor, they didn't believe me. My mom had to drive from West Covina to Lancaster to make the doctors check me because my husband couldn't get to me fast enough. And I literally delivered my son in the hallway. And so, yes.
And let me just say this is so many women's truth. So many Black, so many brown women, so many indigenous women's truth, because people, and when I say people, I mean to all respect to Dr. Kyle Kaiser and all the other great organizations, but not everybody is great. Not everyone is listening. So let me bring Jan in, because I know Jan has so much to say about this. Your first question, Jan, is how are Black women doing? And also I want to add in, is health a social justice issue, and how does it intersect with social justice movements?
Wow. Jessica, love to you. And to answer that question, just about how are Black women doing? And my answer is not so well. But the thing about Black women is, you've heard the saying, we fake it till we make it. We faking it. We putting on our cape, we calling ourselves strong, and we're accepting that moniker, and then we just going out and we keeping it going. We're keeping it moving because that's what we do, right? So when I say we are not well, right, and I'm talking about looking at, if I look at maternal health rates, we are 243% more likely to die giving birth than any other woman. Right?
Can you repeat that? Repeat that number.
243% more likely to die. Right. And we can give the stats. It doesn't matter your social economic status, because if you all recall, Serena Williams almost died having a baby. Why? Because no one was listening to her. Right. And she had to advocate for herself in a very forceful and fierce manner. If you hear about Beyonce, she had problems with her pregnancy. So, but what we don't hear about is our everyday, round the way sister who is just trying to get through this pregnancy or trying to get through this moment, and our families, we don't hear about those. But when we look at the data, that's where it is, right? And then if I look at the other issues, if I look at heart disease, if I look at obesity, if I look at high blood pressure, if I look at diabetes, all of those chronic illnesses, Black women are not faring so well. Right. So, but I don't want to leave us there in terms of us not faring so well. I want to talk about all the things that we are doing to do better, right? That we have not accepted this victimization. We have not accepted this poor health condition. And that's why health is a social justice issue. It's an equity issue, right? Nowhere do we see it shine the light so much as we did with COVID and the pandemic. Yeah. So COVID and the pandemic saw that, you know, if your health insurance was tied to your job and your job was, you know, gone away, or you were an essential worker, or you were a head of household, which made you an essential worker, things got very dicey in terms of the decisions that you had to make about going to work and what was going to happen at work, right? Yes. So, but we stood up for it, you know, we stood up. And then in addition to that, Black women we came out and voted like we voted no other. We have saved this democracy in this country. And I'm not talking only in Georgia, I'm talking right here in California too. Right? So, and that's what I have to say about Black women is that we are super women. And we had this lounge that said Black women are magical, right? And we turn our magic into power. So that's where we have recognized that our health is very dependent upon our social movement, civil rights struggle. Because if we do not do that, we will not have health, we will not have civil rights, we will not have basic human rights, etc.
Wow, that's so true and so powerful. We are magical. We will put a cape on. When we have nothing, you know, they always say, you know, I'm gonna make $1 out of 15 cents.
15 cents.
Right, we're gonna do that because we will do whatever we need to do. And especially in this pandemic, we saw people just be so resourceful with little or nothing, and then they shared. And that was one of the beautiful things that I saw in COVID, that people were sharing. So Dr. Kyle, let me bring you on into this conversation. Again, I really want to hear from you. What is LA Care doing to address the needs of social justice and equity, and maybe even mention any impediments to LA County to full health equity?
Sure. Well, LA Care is very focused on social justice and equity, and especially in 2020. After the murder of George Floyd, which that trial is going on now, we got very, very active as an organization, even more active than we had been for the decade before. Last time I had a chance to work with Jessica, it was a maternal health conference that we're doing that we sponsored, trying to bring knowledge to people about the risks of maternal health for Black women. And I think that's the ongoing work we have to do. We're trying to lift up equity and justice for all people, but clearly in our staff, amongst our physicians, and amongst our members. We have 2.3 million members in Los Angeles County. Almost 25% of the county total population is a LA Care member. As a result of that, we feel an obligation to engage in the communities in a place-based strategy around how we can improve the health of communities, how we can improve the health of people. That's why our community resource centers are in different communities of need. And we've been now collaborating with Blue Shield Promise on the management of those centers, and they'll open up again soon once we get a little past COVID. What are the impediments? I think the impediments are really silos to really address infant mortality, Black maternal mortality, and all the other issues that we've talked about. We have to collaborate with health sector, with the courts, with the educational system, with law enforcement. All these various sectors have to come together and decide to not fight each other, but to collaborate on how we can find solutions in community. So we're trying that. We've collaborated with the LA County Human Relations Commission on LA versus Hate Week that was done from November to December 6th, and we'll do that again this next year. And we're looking for other collaborations. We're collaborating with the California Black Health Network on a statewide Black maternal conference that we're in the planning stages now, that will happen later in the year. And we're looking for ways in which we can first hear and listen, and then engage with communities on how we can make things better, which is why I'm happy to be a part of the conversation tonight.
Thank you. And you know what, you made me think about something. One of the things I'd love to talk to everyone about and how we can collaborate, because we must acknowledge that as we leave out of Women's History Month, we're actually going into Sexual Assault Awareness Month and also Alcohol Awareness Month, which really impacts women and girls significantly. We also have to acknowledge that boys are also sexually assaulted, boys and men. So let's bring this conversation up. It is so critical that we have these types of real talk, honest conversations. And so I thank you all for being here and having this discussion. I think at this time, I want to go ahead and bring the conversation, the question in from Stephanie Walton. And how are we addressing the need to identify and support our BIPOC women dealing with postpartum depression? So any one of you would like to address that?
I think I can jump in and start, and I want to jump in with what's going on in April, for example. April 11th through 17th is Black Mamas Week, right? And so for that entire week, and the April 11th is Sunday through Saturday, we'll be celebrating Black Mamas, and April 16th is Black Infant Health Day. So with that celebration, it is a huge collaboration of different organizations. Mm-hmm. We have doulas, we have midwives, we have what we call the South Bay, South Los Angeles, African American Maternal and Infant Community Action Team. We call it AIMCAT for short because it's a very long name, right? And what people bring to the table in that, they bring resources for mental health. They bring resources for doulas. They bring resources, midwives. They bring resources for mental health. And we will be talking about that and highlighting all of those issues and all of those resources during that week of April 11 through 19. So that's one way that we're trying to address not only postpartum depression, but what the whole perinatal picture in terms of from preconception to conception to postpartum and all that care you get or don't get in that umbrella of time. So that's one way that we're trying to do it. I put our website into the chat so folks can find that, and then we'll also be talking about all of that. I want to say one of the things that will happen on Sunday is we're going to start with an opening ceremony with ritual. Right? And with ritual, we're going to talk about womb health. We're going to talk about fertility. We're going to talk about grief. We're going to talk about the hurt and the pain that comes from being almost a Black woman in America, right? To those of us who have lost children and didn't have a chance to mourn or really, experience that loss in a real way because people want us to shrug it off, right? Hey, just shrug it off. Get pregnant again, do that type of thing. So that's why we're starting with ritual. We're talking about our grief, and we're talking about our fertility, and we're talking about our womb health. And that feeds into both our spiritual health and our mental health.
Right, that's true. That is so true. Jessica, do you want to address that in any way, or Dr. Kyle? And if not, it's okay.
I'll chime in really quick, Miss Candy. I think that what hospitals, I'm sorry. Of course, my phone wants to ring. Okay, there we go. When my phone rings, everything rings. Oh gosh, my godson. Hold on, let me take myself off. Okay, I'm sorry, Miss Candy. But what I wanted to say was I truly think that if you implement doulas in the OBGYN system and within the labor and delivery system, that builds trust from the prenatal through your birthing situation all the way through postpartum. And that gives them just that right-hand person that they can trust, that they'll be able to open up to, and that they can't hide their depression from. And so I always push for doulas and culture competency in the healthcare system. I believe that when you're comfortable with your provider, you'll open up more and you'll be able to receive those resources.
So I love that. And Dr. Kyle, before you jump in, I don't want to take for granted that someone knows what a doula is. So go ahead and state, Jessica, since you are a doula, what is a doula?
It's got a t-shirt on.
My shirt says doula right thing, but a doula to me is a support person, a best friend throughout your pregnancy journey. Someone that is there to not make decisions for you, but to give you the tools to make the decision for yourself, to give you that advocacy, to give you that education, to teach you about your body, to teach you about what's happening with your body, to help you with your baby during the postpartum season, and to advocate for you while you're going to your doctor's appointments. And I look at it as a best friend throughout pregnancy. For me, all of my moms are high-risk moms, and then I also work with NICU moms, so my services are a little different, but it's still that best friend throughout their birthing journey.
And let me say this.
Candy,
go ahead, Dr.
Something real quickly. I think one of the things we have to recognize, so for African-American women, every pregnancy is high risk, no matter what the status of the person is. And so it requires an entire community to surround that pregnant mother during the pregnancy and probably in the first year post-pregnancy. We shouldn't assume that all is well because you see a smile on somebody's face. You got to get close to people. You got to surround them, and you got to keep them encouraged. And one of the big myths that's out there is that a pregnancy, a follow-up pregnancy, is to cure the postpartum depression. It actually is not. It actually can make things a whole lot worse. And so people have to be whole before they have that next pregnancy. And so working with a doula and work with their obstetrician, it's going to be very important in that regard.
Dr. Kyle, let me say, I just want to say thank you for that, because it is true. Every pregnancy is a high-risk pregnancy. I don't know too many women who have not had some kind of experience. And I had an experience that not only did it impact me and my family, but it really impacted my child that I was carrying. And then like 30 years later, we realized that she was really adversely impacted by the experiences, and all of this trauma happened like right at her birth. And again, Jessica, I saw someone said, thank you for paying attention to your bodies. We have to teach women to trust their bodies and get family members to advocate on behalf of us. That sometimes we may not be in that position to say something. We need the families there to advocate for us. And I know when I was pregnant, my doctor, the anesthesiologist wanted to do something, and I was like, no, we're not going to do that. And he was like, well, yes, you are. Why aren't you going to do it? Just because you're the anesthesiologist, you don't know me and you don't know my body, and you're telling me to do something that to me, it just didn't make any sense. And so when I argued and fought back, my doctor came in and said, okay, well, look, we're going to find a happy medium. And it was because of me fighting back that my child and I are still alive, because I didn't realize that at the time I'm one of like 2% of the population that is allergic to epidurals. And I actually felt like burning oil being poured in my back, and then I had a seizure. So it's important that we listen to our bodies. We listen to our bodies and advocate and say, nope, that doesn't work. And just because it is a doctor doesn't mean it's right. Go
I
ahead.
want to jump in here. Okay, because you know I've been like trying to jump in. Okay, first of all, I want to say that a pregnant woman in labor should not have to advocate for herself. She needs to be focusing on her labor, right? And I also want to say that we have a system that is broken. It is totally broken. The system is set up against us. It is racist and it is sexist. So therefore, I just don't want people to think that they can, I don't want women to take on the burden of having to advocate for themselves, or the doula to take on the burden of having to be the advocate, because the system is broken. We need to change the system. We need a new system, right? One of the things I am going through 3 pregnancies right now, okay? And what I mean is at Black Women for Wellness, we got 3 folks on staff who are pregnant, right? And what that is saying to me, what I am learning in this process is one of the things that they have not been able to do and have had to have a sense of is to have a continuous provider, either a continuous midwife, a continuous OBGYN, a continuous nurse practitioner, somebody who builds a relationship with them so they remember them from last time, remember what they said, remember what's changed, etc. That's a problem with our system, that we don't have a continuous person that we have relationship with throughout the pregnancy or throughout our childbearing years, for that matter. So that's a system problem. It's not a problem that we can expect a doula to solve, or particularly a pregnant woman to solve. It is a system problem we need to attack, right? Black Women for Wellness does a lot of policy. One of the policies we did was SB 464, which is a Dignity in Pregnancy and Childbirth Act. This is asking for all perinatal providers to get implicit bias training. That means we want you to recognize when you have your implicit bias, or when you have your racism, and when you have that going on, that you can step back and say, wait a minute, am I listening to this woman? Am I listening to this family? Am I helping them make good decisions? Am I making decisions for them? Type of thing. So that's what the part that I wanted to say is, let's not continue to blame the victim for the crime or the family for the crime, but let's look at the system and the challenges we have with the system right now that needs change, that needs addressed.
And I totally agree with you, but I think it's still important that we let people know you can advocate. I think that a lot of people are thinking that, well, as Jessica said, this is a doctor, they know better. This is this kind of person, a lawyer, a teacher, or whatever. If it does not feel right, we must say, this is not right. This is not right for me. And I need to see another doctor. I need to see a different teacher. I need to move this up further. And so, Dr. Kyle, I've got not only a question for you that you've helped me to form, but there's a question for you in the chat. It says, Dr. Kyle, can you address the importance of also having an infectious disease physician, especially if you have COVID, recovering and possibly staying protected, if possible?
Yeah, I think having an infectious disease doctor when you have a major infectious disease, especially one that is life-threatening like COVID, is a great idea. They are in short supply. So it can't be a requirement for everybody because you won't find enough infectious disease doctors in our community. However, a good internist who works with an infectious disease doctor, a family practice doctor, is also very, very valuable. One of the things we're learning now is that it's possible that many of the people who have died from COVID in the last year, some of those deaths were unnecessary because we had medications that could have saved their lives in the hospital. They actually could have saved their lives before they went into the hospital, but there was a general lack of knowledge around that because of all the denials that were coming out of Washington. But when the former president got sick, he got those medications, and talk about monoclonal antibodies, and others who in the administration got those same medicines, and you wind up in the hospital, you don't get it. I've lost friends and family members to COVID, and not one of them, when I researched it, got the treatment that I think they actually needed. So having an infectious doctor, infectious doctor is good, infectious medicine doctor, but self-knowledge, education, being, training ourselves about our bodies and listening to the science and not to the myths that are out there will keep us alive. Myths will get us killed.
So we are coming up on 7 o'clock. I just want to acknowledge that. We try and stay within our timeline, but this conversation is so rich. We're going to go over a little bit. So I just want to let people know that and let you know that I know that. And I want to end with one final question for everyone. This is a question that is actually for Dr. Kyle, but I think it's important that everyone addresses this question. So what would you advise other health plans, health systems, or even doctors to think about in the near future in regards to the health equity? And so let's start with you, Dr. Kyle.
Okay.
Then we go to Jessica, and we end with you, Jan.
Well, I think the most important thing for doctors, health systems to recognize is the impact of structural racism on medicine and the impact of structural racism on communities. In our health plan, we have 2,000 employees. We're putting them all through diversity, inclusion, and equity training. We're putting them through implicit bias training so that they can be more aware. I think every doctor ought to go through that training. I think health systems ought to be thinking about it. I think we have to basically recruit more people of color, people who have had experiences in the community that understand what's going on, and put them in places where they can have an impact, put them in places of authority. And but if we ignore structural racism, it will continue unabated and will actually, what we've seen in the last year, it will accelerate. And we can't ignore that. So that's what I would probably encourage people to do as we go forward, is to address it, to acknowledge it, and then to practice anti-racism.
Thank you very much, Dr. Kyle. Jessica?
So one thing I would say, Ms. Candy, and I actually had to tell this to a hospital that we're partnered with, Mighty Little Giants, is that the directors in these hospitals, they need to recognize their own implicit biases before any change can happen. You need to recognize that everyone has implicit bias, recognize your own so that you can be the change in your hospital on the director's level. And to also make sure you have a diverse staff, make sure that your staff looks like the people that you're working with, the mothers and the fathers and the birthing people that you're servicing in your community. But acknowledging your own implicit biases is step one to any change. You have to admit that there's a problem. So that's what I would say.
Thank you so much, Jessica. And Jan?
Okay, so yes, we are all about the policy of creating policy for change. When I think about diverse staff, I want diverse staff in decision-making positions, right? Especially those that control the budget and the money, right? Because if you just have a diverse frontline staff, that's not enough, right? And that also means that we got to put people in the pipeline. So put people in school and fellowships and internships to be able to take those positions when they come up. For those of us in the community, we need to volunteer. The AIMCAT is loving some volunteers right now. We have so many community groups and work groups with the AIMCAT where you can volunteer. One of the things that takes away our power is when we are isolated. So not only can you volunteer with the AIMCAT or Black Women for Wellness, but we can volunteer with Positive Results Center also. But the point is not to be isolated and to be part of the solution and not just sitting on the couch with your mouse clicking, right? You need to get out and do something. And that will give you more information. To inform yourself is paramount. So we need education and information for our community, for our healthcare providers, for our government officials, and that information is rooted and centered in the Black experience of the United States.
Thank you. Thank you so much, Jan. Let me just say this. When you support a Black woman, when you trust a Black woman, you're not just supporting a Black woman, you're not only supporting that family, that community, but we work with everyone. We bring the whole circle together. And so it is really critical that you think about if you can't support us in volunteering or making a donation or sharing even our flyers and the information that you see on social media, calling us up and saying, what is it that you can do in your community? We work with everyone. We want to support everyone, because when you support one person, you support the whole community, and it's critical that we heal the entire community. So I want to thank each one of my guests. You have just been amazing. We could be on this panel all day. And of course, we spent the first, 20, 30 minutes trying to get the system right. And now the system is right, and it's time for us to end. So I thank you again, Jessica Way with Mighty Little Giants, Jeanette Robinson Flint with Black Women for Wellness, and Dr. Kyle with LA Care Health Plan. We thank you so much for being here with us today. We are going to close out a few minutes late, but I also want to do this. If you have not had an opportunity to put your organization in the chat, please do so. You see, we're actually partnering with another organization that's going to look at all of our videos and also all of our comments, and we're going to put together a report that we will share with you. If you are interested in being one of our speakers, we want to know that. If you have a BIPOC organization, please share it so that we are able to share it with the community. Because one thing I do know is this: we don't know what we don't know. So if you let us know who you are and what you're doing and how you're doing it, we can then create a resource list for the community. And again, please make your donations. Make your donations to Positive Results or any one of the other organizations that's been here today. Last but not least, we will be back on June 15th. And on June 15th, we will have a conversation on housing insecurity. And all of these conversations really are partnering right off of each other. Talk about how health and wellness and affects housing insecurity. And we did talk about education the week before. So you saw we talked about depression and suicide in that conversation, and we brought it up here as well. Our community needs help. Our community needs healing. We cannot do it alone. If you have a health plan or a health organization, or if you are a doctor or medical provider, partner with Mighty Little Giants, Black Women for Wellness, California Latinas for Reproductive Justice, or Positive Results Corporation, or, Positive Results Center, or reach out to us to find out what other organizations can provide you with the culturally specific, trauma-informed resources and tools and training. And I do want to thank our sponsors. I started off and our time just went by so fast. So let me acknowledge all of our partners. We have some amazing partners. And first and foremost, we want to acknowledge our lead sponsor, SoCal Gas, Supervisor Hilda Solis, Liberty Hill, LA Care, Kaiser Permanente, Black Women for Wellness, the Los Angeles Business Journal, Vermont Slauson Economic Development Department, Sweet Life, and Mac Enterprises. I want to thank you, each and every one of you, for being here today. What I'd like you to do is not only sign up right now for the next series on housing insecurity, but also tell a friend. Next time, come back with 2 or 3 friends, because this information is critical. The conversation has been rich, and we can't do it alone. We need you. So I thank you. I thank you so much to all of our guests. You have been phenomenal. To all of our partners in the lounges. If you're interested in having a lounge, we only have a couple of requirements. Are you a Black, Indigenous, or person of color organization? And that includes for-profits and nonprofits. As long as you are not selling, because we do not believe in charging our community. So you might have a product that you can charge for, but here we want you to provide a resource. We need the resources. We need you. I thank you so much. I'm Candy Lewis, Executive Director, CEO, President, whatever I need to be. best friend, mentor. I am she, and I'm Candy Lewis. I want to acknowledge my team. I have the best team in the world. Crystal and Arnetta have been in the chats. Kelly and who I say? Okay, Crystal. Okay, Precious. And Crystal and Arnetta, I've seen them in the chats. You all have made some chats to me, and I cannot get to those chats and also do this. So I acknowledge you. I see you. I'll reach out to you all. Kelly and Gia, thank you so much. Ashley and Aaron in the green room, thank you so much. Again, it has been our pleasure. We look forward to seeing you again soon. Thank you. Be safe, and we will bless. We want you to be blessed. Have a great day. Thank you.